Hi, so today I'm going to talk to you about the healthcare system in the United Kingdom. First, I'm going to give a general overview of how the healthcare system is organized and then go into a bit more detail regarding the English healthcare system. So, within the United Kingdom, which comprises of England, Scotland, Northern Ireland, and Wales, each country runs their own health system within their own respective governments. And uh, Worldwide, it's an acclaimed healthcare system. And for instance, in 2014, it was best ranked in a number of categories, a few of which include access to care, quality of care, palliative care, and effectiveness and equity. The primary source of care in each country of the United Kingdoms are general practitioners, or GPs as they're more commonly referred to, and they are the ones that refer patients to specialists and consultants if need be. Ambulance services are free at point of service. Dentists are not covered via NHS insurance, but they can only charge fixed rate set by the NHS. So there's not that much competition between dentist providers as they all charge the same. The only way they compete with each other is through quality of care they provide. Pharmacies are privately owned and operated, but they need an NHS contract to operate, and their quality of service provided is tightly monitored. And The private medicine sector in the UK also exists, but it's relatively small to other countries, especially to United States, which is covered also in this presentation. And Mainly, the private sector is crossover with the NHS. For instance, when NHS wants to expand its capacity, it goes to the private sector, and also the private medicine sector doesn't usually have level 3 intensive care units, so they usually refer those patients to NHS hospitals to be treated there. And also, because the private medicine sector is small, throughout the years there's been a positive trend of medical tourists going out of the UK. For instance, in 2016, we had 144,000 medical tourists going abroad. So, the respective health systems in each country are NHS England, NHS Scotland, NHS Wales, and Health and Social Care in Northern Ireland. It's commonly referred to as NHS Northern Ireland, but that's not its official name. So I'm gonna give a few differences between those systems, which are not that vital, but I just thought that they could be fun to know. So, first up, non emergency medical advice can be reached via telephone on 111 in England and Scotland. And on Wales, it can be reached on 084 546 47. In England and Wales, NICE, as it's shortened, set guidelines on how specialists and GPs should treat certain conditions in order to maintain cost effectiveness, but at the same time provide high quality of care. The Scottish Medicines Consortium advises NHS boards in Scotland when to use antimicrobiotics and formulas in order to prevent the more growing threat of superbugs. The National Audit Office in England and the Audit Scotland in Scotland provide cost control. And also, the main difference, or what the English system is special, is that in hospitals, the parking is free in Scotland, Wales, and Northern Ireland, but in England it's charged. And also, England is the only country that charges prescription rates around £8.60 per prescription, whilst noting that under 16s and over 60s are exempt.